To Florence Gillette.
Thank you very much, Your Excellencies, your dear partners, dear friends, good morning. It's really an honor to be with the MSF family and all of you today on this occasion marking 40 years of sustained delivery of health services by MSF team to the population of South Sudan affected by conflict, violence, natural disaster, and outbreaks and pandemics. Over these decades, ICRC teams have had the privilege to work in close coordination with MSF teams, in particular at times of conflict-related crisis. I personally worked very closely with MSF teams 10, 9, and 8 years ago during the conflict in Jonglei, but also during the outbreak of the war in December 2013 and early 2014. The ICRC is not a health organization per se. The ICRC mission is to prevent and alleviate the suffering of population affected by conflict and violence. At times, and regularly, it entails some health activities and protection activities. On many occasions, the ICRC and MSF cooperated, complementing each other and also sometimes working alongside each other in the field. During the civil war, as of 1983, the ICRC started to extend health services for the population of southern Sudan at the time, and particularly for weapon wounded. This response culminated with the Lopeling Hospital located in Lokichokyo in Kenya, where close to 38,000 war wounded from southern Sudan were referred from 1987 to 2006, whilst other teams were operating from Sudan, from Khartoum and the north to cover other parts of southern Sudan. For decades, and still today, the ICRC has been supporting the South Sudan Red Cross and its predecessor for southern Sudan to deliver first aid services and to train others to do so throughout the country. With the CPA bringing respite in fighting in the country, a smaller scale war-wounded and weapon-wounded program was pursued in Malakal. But then, as of 2013, the ICRC again had to increase the surgical response, first in Jonglei and then in many places throughout the country as of December 2013. In many occasions, there were cross-reference of cases with MSF, there were reflection with MSF, sometimes pulling resources together when we were lacking certain skills or certain facilities. With the decrease of the hostilities since the revitalized peace agreement, the number of weapon wounded significantly decreased. However, intercommunal violence and pockets of conflict continue to injure and maim people throughout the country. A few wounded also from the ongoing conflict in Sudan recently arrived to South Sudan. MSF regularly treats but also refer cases to ICRC that treats them in the Juba Military Hospital or in the Akobo County Hospital. As the global humanitarian funding is decreasing sharply, and also this affecting particularly South Sudan, the ICRC plans so far to maintain this response in Juba, though it will have to pull out its permanent presence in Akobo mid-next year. Surgery is essential for war and weapon wounded, but for it to achieve a sustainable impact on life shattered by a traumatic event, it also requires, importantly, physical rehabilitation and mental health support. The ICRC, but also MSF on many occasions, are working on those aspects. The ICRC, for instance, also work and train physiotherapists from the MOH, worked alongside with physiotherapists from the MOH in Akobo, and works on the training of physiotherapists provided by St. Mary's College in Juba. On mental health, the ICRC also works with the MOH staff on how to accompany people who went through trauma through recovery, also through mental health and not just physical health. One of the key challenges that ICRC sees for South Sudan, and it's a very specific one, and it comes in addition to what was explained during the speech of introduction but is really the need to enhance the capacity to train, develop and sustain, amongst other things, surgical and anesthetic services that are accessible to all, particularly to the most vulnerable, affected by violence, conflict and natural disasters, and who cannot afford private services. Investments, together amongst partners or individually by partners such as MSF and other actors or the ICRC, but also separately by the MOH, have been made over the last decades to create a tailored response that would leverage the skills and competencies in the country and find adapted solution, localized solution, taking into account the challenges faced by the system here, including in terms of staff retention in the Ministry of Health. Moving on to another matter, MSF has played and continues to play a key and a central role in primary and secondary health care in South Sudan. For ICRC, PHC is not necessarily a central part of its response. However, as we've done in the last decade and in prior decades before the CPA, the ICRC might leverage its role as neutral intermediary and its acceptance by all parties to support the provision of primary health care. This has been done in the past, and this has been done at specific times, which were time-bound, and because the Ministry of Health and other actors were struggling to deliver services across frontline in hard-to-reach area. Once the hostilities subside and once there is no neutral intermediary needed to ensure the provision of services, in particular by MOH facilities, it is normally time for ICRC to pull out. Last time, the last few years, we stayed a bit longer, but now that the conditions are such that the Ministry of Health and all actors can work throughout the country, we are pulling out from the primary healthcare support. From supporting 23 PHCCs serving more than 600,000 people in conflict-affected area in Greater Upper Nile and mainly, but also a bit in the Equatorial and Barre Ghazal, the ICRC has phased out already from 19 centers in the last 18 months and will phase out its support from 4 more. Throughout those phase-outs, we've coordinated with other actors. We've coordinated with the authorities at county, state and national level, trying to find sustainable solutions to ensure the provision of primary healthcare services to those populations. However, considering the high operating and cost in hard-to-reach areas and the limited means of the health system, sustainable solutions have been very difficult to find, and in more than a third of the cases, we haven't found any sustainable solution, and PHCCs have had to reduce sharply or stop their activities. This panel is very representative of the key actors that have started and need to continue working together to find ways for a smooth transition from a system that was depending for close to 75% on traditional humanitarian support to a new system and strategy as humanitarian support will continue to decrease, the financial humanitarian support. This new approach, under the lead of the authorities, will require collective solution to mitigate this impact and the impact of decreasing international financial support. Linking into my earlier point on weapon wounded, it's also very important that this new strategy includes solid referral pathways between all levels of care, from community-based health and first aid to level 1 care to level 2 and level 3 care. Before closing and echoing something that was discussed before, I'd like to highlight the work of all those represented on this panel to respond to a key concern in South Sudan, that has been the protection of the medical mission. The wounded and the sick, health worker and health facilities have to be respected at all times. Unfortunately, we all remember the many hospital and primary healthcare centers attacked, looted and destroyed, including MSF facilities. We will always carry the memory of the patients killed in their beds or not on their way to the hospital, and of the health staff killed during those events. As the hostilities subsided, the ICRC has observed a sharp decrease in occurrence of violent and massive attacks against the healthcare in South Sudan. Still, incidents against health staff and structures still occur. Therefore, it remains essential to uphold the awareness of weapon-bearer security forces as well as individuals that health services are there to serve all and should be protected and respected at all times. On that one, the ICRC will continue its work with the armed and security forces to enhance compliance with the international humanitarian law and international human rights law, including on matters related to the protection of healthcare facilities, medical staff and patients. Looking forward to discussing further.
Thank you so much, Florence.